Hey everyone, this is Daniela from the Obstacle Doc, and today we're talking about the abdominal wall, what it does, and how we're going to try to activate the 4 different components of it. So when we're talking about the abdominals, there are 4 layers and they're running this entire center of the body. So one of the quickest ways that we can kind of identify if there is a strong control or lack thereof is what we call the rib flare. So when you're looking at someone's spine in neutral, and again, we can go to our ideal posture or our hip hinge video to kind of further deep dive this. But when somebody comes out of this neutral line, a lot of the times what you look for is kind of in the lumbar area if there's an excessive curve. But the other thing that we can check for is if the ribs are, instead of being here, they're kind of starting to open up through the chest, and that's usually a sign that we're getting some length differentials in this midsection. So for Christopher laying down here, what we can start to appreciate is where his ribs are kind of falling naturally. For some people, if there's a lot of tension, even in the upper musculature of the shoulders, of the upper back, this can be a little bit more aggressive or less aggressive depending on just what they're kind of resting at. So as you can see, there's a little bit of some lift off here. What we can probably feel too is that there's a little bit of space or more space created around the back versus the floor, so less contact, if you will. So what we're going to try to do is for this top muscle, so we have our rectus abdominis, which is the most superficial layer. We are going to try to tackle the rib flare first with the rectus abdominis. So what we're thinking of is pulling this rib cage down with an exhale. So he's going to try to breathe out through the mouth, and you can see there's just a little shift down from where he was before. So go ahead and release again. So just a little bit of that rise, and then as he exhales, he's going to pull down. He's almost going to try to knit the rib cage together. So we can make this a little bit more dramatic if we go into a field goal position. So go ahead and put your arms out to the sides. And this is where we really want to appraise what's going on in the center of the body. If you're doing overhead squats, if you're doing any kind of overhead lifting, and we're having any kind of, maybe it's tension somewhere in the lower half of the body, maybe it's even tension through the lats, this can start to increase that spinal curvature and get that rib to come even further up off the center of the body. So in this more challenged position, again, he's gonna have a little bit of a harder time because now he's fighting other areas of tension through the spine. So go ahead and relax and do that one more time. So we're gonna exhale. We're thinking of just knitting down, pulling down from here. Perfect. So as Christopher is pulling down from the abdominal, so if he's pulling down that rib cage, you can start to see even too that his arms will lift off a little bit, whereas before they were flat on the ground. So this could be an indication that there is tension somewhere in the rest of the system that's causing this excessive arch through the spine. So going from superficial to deep, we have the rectus abdominis, we have the external obliques, we have the internal obliques, and then we have the transverse abdominis. So that is the deepest layer. It's the one that goes from one side of the spine all the way, wraps around to the other side. This is what a lot of people will incorrectly call your lower abdominals. They actually do run the entire length, but it's just that we feel more of them in the lower part of the center of our body. So that's how people call them the lower abs. They are in the entire space, so we are going to try to work them to their fullest degree. So the way that we're going to find our transverse abdominis, we're going to go to the protruding bony parts right here at the front of the hips. We're going to let our hands lay flat here across. And what Christopher is going to do is he's going to take, good, yep. He's going to take a nice big breath in. As he exhales, we're going to pretend like we're blowing up a balloon. We're trying to force as much air out of our mouth as possible, like we're blowing through a straw. And just with that much pressure, pushing out, we're trying to get to the area between the hip bones to kind of tense up and tighten up underneath our fingertips. That's the first way we try to cue it. The other thing to think about is pulling a really hot pair of skinny jeans out of the dryer and you're trying to zip them on in. That's the other way to try to appreciate that. So once he has that kind of tensed, now we're gonna layer in the rectus abdominis. So he's tight through the bottom or through the transverse, that deep layer, and then we are going to seal down from our rib cage as well. So now he's activating the deepest layer and the most superficial layer to hold this all in neutral. This is what we want to maintain when we're going through our hip hinge, when we're going through our heavy lifts. This creates that brace through the center of the body. So if you think of like a little abdominal binder, this is the body's natural abdominal binder. So when we think of functional movement, functional activities, or exercises that we have in group fitness classes, this is the area that we're trying to target whenever we are doing active flexion through our spine or holding neutral through our spine. If we're starting to lose this center, and maybe we're starting to feel our ribs open up more, we're starting to feel our pelvis rotate on us without our control, that's usually an indication that this is not tolerating load as well as it should. The other thing to think about is our obliques. So when we talk about rotation, that's really our obliques job. So our external obliques are going to take us away from the same side. So left oblique is going to take you to the right. Left internal oblique is going to pull you back to the same side. So when we're going through our active range of motion for our obliques, we really don't want to make it a super dramatic motion, because then we're starting to turn from our spine rather than turning from the control of the muscle itself. So holding all four of those components in together is going to keep you in a much more stable place.